Okay, let's go ahead and start as people join. Welcome, everybody. My name is Sarah Martin. I'm the moderator of the GBV Community of Practice, along with my colleague Shiva Sharifzad, who is supporting us technically today. We are managing the GBV Community of Practice, of which most of you are members. Can you give me the next slide, please, Shiva? So today we're going to be talking about technology-facilitated gender-based violence. So if all of you who've signed up must probably know that it's an evolving form of violence that's been intersecting with the existing forms of GBV that we already know about. Survivors are experiencing a wide spectrum of harms, and we'll hear about this from our speakers today. At the same time, technology plays a vital and growing role in supporting survivors. So while awareness has grown significantly, we need to also remember that technology is not new to GBV, nor is its use in perpetration of harm. Across decades, different technologies have been consistently used to facilitate abuse in both visible and less visible ways. So this historical perspective is a useful reminder that GBV responders have long been working with evolving tools of harm, and that technology has equally long served as a tool for resilience, connection, and help seeking. So as we grapple with this topic for the next hour and a half, we remind everyone the core principles of the survivor-centered response are going to remain the same. And now they are going to guide us in how we're approaching the use of technology in gender-based violence. So in February, one of the GBV COP members asked for more support on case management for technology-facilitated GBV. So we're hosting this webinar where participants were going to hear from UNICEF on the current landscape of what's happening with TFGBV. We're going to learn more from local organizations in Syria, Iraq, and Myanmar, Thailand, about how they're addressing TFGBV in practice. And then UNFPA is going to show us some of their practical tools and resources that they've been developing to address this gap. Now, you're encouraged to submit your questions and share your own challenges and response in the chat and also in the Q&A, because we will have a Q&A session at the end where you can speak to all of the different panelists. And if you would like to share what you're doing in your country, we invite you to do that as well. So can you go back up one more, Shiva? So for those of you who are new to the community of practice, we're a community of over 1,000 GBV and emergency specialists around the world. So we offer a virtual platform with webinars like this, capacity building events, peer-to-peer support, and it's a place for you to connect with other GBV specialists to ask your questions, provide support, and share resources. Membership is free, and it's for any individual working in GBV and emergencies. So you join as yourself, not as your organization. If you want any more information about joining, you can send us a message to gbvcop@gmail.com, and I'll put that in the chat as well. And we would be very happy to see you. Okay, with no, I think the slide right, yes. So the questions that everyone always asks in the chat, let me address them now. The webinar will be recorded, and we will share it with everyone who's registered. Please feel free to share any materials you've developed. You can put them in the chat, and then we sent you a resource list before the webinar started. We'll update that and send it out again, as well as keep it in our GBV resource vault, the Community of Practice resource vault, where you can revisit it and download reports and PowerPoints and any other things that we share. Again, we're going to have a Q&A after the presentation, so just add your questions to the Q&A button at the bottom, or you can put them in the chat and I'll monitor them. And we also ask if you could stay to the end to give us some feedback. We're going to have a short poll, and you can always share any comments or thoughts directly with us at gbvcop@gmail.com. Okay, I'm going to take it back to the agenda and share and invite Megan O'Connor from UNICEF to open us up and to tell us more about your skipping study.
Great. Thank you so much, Sarah, and thank you to everyone who has joined. It's an honor to be with you today. As Sarah said, my name is Megan O'Connor, and I work with UNICEF's Gender-Based Violence and Emergencies team. Last year, we carried out a scoping study on technology-facilitated GBV for a couple of reasons. One, we are already working on TFGBV primarily through a risk mitigation lens through our virtual safe space platform called LAHA, laha.org. And in the way in which we built the platform, as well as some of the content on it, we're primarily focusing on how can we reduce risk for women and girls in humanitarian settings related to TFGBV. But we kept hearing from country offices and from other actors in the field that, there was a lack of resources for really thinking about how do we address this problem, both from a prevention, response, and even from a data perspective. And so we wanted to embark on this scoping study to just figure out what the landscape is. Next slide, please. So for our methodology, we held 15 key informant interviews with a range of actors, including UN agencies, donors, international, regional and national NGOs, working in both humanitarian and development spaces. We reviewed relevant documents, so programmatic briefs, research briefs, academic articles, and then we held our own internal consultations with UNICEF country offices. Next slide, please. So let's jump right into what we found as part of this study. And just a reminder that this was not focused only on response to TFGBV. So primarily what we see is that there are interventions that are mostly outside of humanitarian spaces and that are at an institutional level. So an example is norms and tech regulatory work with countries and industries, advocacy at a national or regional level to incorporate TFGBV into GBV legislation and frameworks. We see some direct programming, primarily related to women in public life, so female politicians, women human rights defenders, and activists. As many of you probably know, there's a lot of child protection resources out there, but these lack the framework really needed for women and girls, and particularly that survivor-centered framework. And then in terms of literature and resources, there's a good amount out there on defining the problem and the scope, some frameworks and thinking about how do we address this, but limited guidance for response. And if there is some, it's not widely known or available and not necessarily humanitarian focus. And I know some of our presenters today are going to help us think about how we address that gap or are already trying to do that. And then there's some risk mitigation tools out there for developers, but again, not necessarily using that kind of feminist lens, women and girl centered lens. Next slide, please. So challenges that we identified. The problem is too big and there's so many different entry points. So many actors, indicated kind of an overwhelm in terms of where do we start with this. It's hard to change the behavior of the companies and businesses without having real incentives for them. We found that there's a real lack of coordination amongst actors, and as a result, an inefficient use of limited resources and access to opportunities to get resources. Another piece that we found is that often there's a delinking of technology-related violence from GBV programming. And this impacts our service delivery models, it impacts our advocacy, and it also impacts access to justice options for survivors. One example is, and this goes back to the work that's being done on incorporating TFGBV into GBV legislation so that survivors of TFGBV can actually access the same services and justice options as GBV survivors. And then humanitarian settings, the problem is very much minimized because it's not considered life-threatening, or there's an assumption that these settings don't have technology and internet, so it can't be that big of a problem. Next slide. Our study also surfaced some important tensions for us to think about as a community. So this piece around privacy versus safety, and this is particularly applicable for adolescent girls and women. So for example, in the child protection space, there's very much a framework around safety. And yet in the GBV space, we also think about autonomy and the ability to choose your own privacy settings, et cetera, in the way that you would like to. There's the digital platform paradox, right? So there are platforms that offer services and support, especially in humanitarian settings, yet these are also sources of exploitation and harm. This again, this GBV versus TFGBV, we obviously know as a community that, these things don't happen separately. They're often on a continuum and happening at the same time to the same person. But nonetheless, how does a focus on TFGBV take away from programming research resources for non-tech related GBV? Empowerment without victim blaming. And so, the resources that exist out there on risk reduction, so digital literacy, online safety resources for women and girls, it's important that we have them and it's important that women and girls have access to them, but we also want to make sure that they're not victim blaming or suggesting that women and girls are somehow responsible for the violence that's happening to them. And then lastly, attention around there's obviously a gender digital divide. And, in our field, we're always advocating that women and girls have greater access to technology. And yet, this technology is also causing greater risk for harm. So it's just kind of a tension that we need to think about. Next slide, please. So overall, the gaps that we found, definitions and standardization. So we really do, as a community, need shared definitions and language for TFGBV, particularly for humanitarian contexts where conflict-related forms are overlooked. And I'll talk a little bit more about that on the next slide. Measurement and evidence. There's a need for cohesive evidence on TFGBV, especially in humanitarian settings. We could be or should be collecting incident and service data, qualitative data on exposure and impact, and we also have minimal evidence of what works. Thirdly, service delivery tools. So staff really need tools and training to incorporate addressing TFGBV into existing programming and services. And here I'm not just talking about case management, but also thinking about even in the context of sort of the traditional women and girls safe space that is operating in humanitarian settings. How are we incorporating information about TFGBV? How are we using the existing knowledge that we have to really make sure that we're addressing TFGBV more comprehensively in the way that we address overarching gender-based violence? Next slide. Fourth, risk mitigation and tech programming. So developers of technology and humanitarian actors that are using and deploying that technology in humanitarian settings need resources and training to understand and mitigate the risks that are associated with digital tools specific to women and girls. Without this, we keep kind of proliferating digital tools that are actually increasing risk for women and girls. Here I'm coming back to this piece about conflict-specific TFGBV. So we also need to be considering in humanitarian settings and fragile contexts what the unique conflict-related forms are. These are being overlooked, and so we're not necessarily addressing them in our programming. Drone surveillance targeting women, mis and disinformation, unsafe online services, technology-enabled trafficking. And there's many others. And then lastly, survivor and community awareness. So we found then, many practitioners shared with us that, what they see is that women and girls often cannot identify their experiences as TFGBV. And so what this means is that they don't disclose their experiences, and then they're not necessarily accessing the services that they need. And next slide, I think that was it. Yes. Thank you so much. I know we'll have Q&A later, so appreciate, if you have any questions, happy to answer them later. Thank you.
Great. Thank you so much, Megan, and thanks to UNICEF for putting together this really comprehensive overview. Now I'm going to invite Ava and Hiba to speak about the work that they've been doing in Syria, and I'll let you introduce yourselves.
Hey everyone, thank you, Sarah. So my name is Eva Veličko, and I'm an independent consultant, researcher, and I worked on the report on TFGBV in Northwest Syria last year with ACAPS and UNFPA. And with me, we also have Hiba, who we back then interviewed as a key informant for the interview for the report, and she agreed today to contribute her knowledge and expertise to the presentation. So thank you so much. And without further ado, let's move forward because we don't have much time. So the report, if I could ask for the next slide, thank you. So the report was published last year. The objective of the report was to inform of the scale, trends, and impact of TFGBV in a very specific context of Northwest Syria. But the findings of the report can be extrapolated across the country. And during the drafting period, we also there were many political developments in Syria last year that sort of made it made it possible to extrapolate the findings for the whole country. So the contents of the report that will be in the resource list is what are the different forms of TFGBV across the region, what are the patterns and trends, perpetrator and survivor profiles, the main tools used, and online and offline impacts. And in order to describe that, we did a secondary data review, of course, but we also interviewed GBV and TFGBV experts, journalists, activists, and we did 7 focus group discussions with women and girls from affected communities, with GBV service providers and online activists. Next slide, please. We also, I just wanted to showcase that we developed an analytical framework for working on TFGBV research. That has been adapted. Maybe some of you can recognize it from the GBV AOR framework, analytical framework. But we made it very TFGBV specific. So we looked at context and gender dimensions in the country, underlying risk factors, and nature of trends of TFGBV, different characteristics to come up with the humanitarian profile of needs and capacities to address and mitigate TFGBV risks. So this is basically the scope of what we analyzed, but I will switch to the next slide. So I'm sorry that you don't have enough time to go into that. I just wanted to take 2 minutes to describe what is maybe very specific about TFGBV in Syria, and what are some factors that aggravate it and main impacts. So when it comes to drivers of TFGBV in Syria, we talk mostly about very limited digital literacy and low capacity of people, particularly displaced people or people living in rural areas that do not have access to internet as much, or mobile networks. They are not prepared really to understand the risks associated with it. We have the accumulated effects of protracted conflict, including access issues. There were political divisions. There was a lot of displacement that aggravated the risks. And we talk about economic precarity. So particularly in the context of Syria, as I'm going to explain, the main motivation for TFGBV was either financial or sexual exploitation. So of course, we also speak about entrenched conservative gender norms, which connect to significant shame and victim blaming. And of course, the aggravating factors was that there was a lack of legal frameworks governing cyber violence, ineffective law enforcement, and which led to perpetrators operating really in a climate of near total impunity. And of course, as was already mentioned, TFGBV happens in the spectrum of GBV, so it has real life consequences, including financial, sexual exploitation, forced marriages, mental health challenges, social exclusion, restricted access to livelihoods, education, essential services, and public life, and the risk of further violence from survivors' immediate community and family, including so-called honor killings. And the main factors of vulnerability for TFGBV in Syria, the most affected groups we identified were adolescent girls and young women, young female IDPs, widows, women heads of households, also boys and young men that were targeted for recruitment online. And the factors of vulnerability included reliance on online platforms for social interactions, income, or access to services, including humanitarian services, disability, or being in a public profession, being a journalist, activist, having significant online presence, which exposes people to harm, being threatened, or defamation. Next slide, please. As I've mentioned, the primary motivations for TFGBV in Syria that we identified were financial and sexual exploitation, revenge or coercion, defamation or causing reputational harm, particularly to people with more online presence or public positions, or simply to threaten, cause harm to, or harass an individual. And when it comes to main trends, TFGBV incidents correlated with major political humanitarian developments. So the more displacement there was, the more conflict there was, the increased vulnerability to TFGBV as well. Population movements were associated and likely to aggravate the prevalence of TFGBV. It was more reported in urban areas because of higher access to internet, but IDPs from rural areas that would displace to urban areas would have a higher risk profile due to lower levels of digital literacy. And then we had camps which host IDPs that had an increased risk profile, digitally network communities, and very interesting part of gaming platforms or platforms that are de facto gaming, but really used for income generation. They are susceptible to hacking and exploitation of both young boys and girls and adults that use them either for livelihoods and earning money or entertainment. Next slide, please. I think I'm running out of time, right, Sarah?
You have a few more minutes.
Okay, perfect. So when it comes to the main forms that we have identified, TFGBV in Syria really focuses on one hand how to acquire the data that will be used for TFGBV, different forms of TFGBV, and the online consequences that it entails. So there is really no close-ended catalog of TFGBV forms, and they rapidly evolve in line with new technological developments and increasing access to mobile connectivity, social media, and other digital tools, and particularly right now also with how advanced AI image and video generation becomes. So, for example, hacking a social media account or a mobile phone can give a perpetrator access to private pictures, leading to threats of disclosure such pictures, which we call image-based abuse, distributing private information from that form, which we call doxing, and or economic or sexual exploitation, which we call sextortion. Often leading to sexual violence, harassment, defamation, or other real forms of GBV, which can potentially escalate to so-called honor killings due to culture of victim blaming in Syria. So nearly all of these interviewed for this report highlighted that blackmail was a primary concern and result of most of the TFGBV forms outlined here. Perpetrators would often use pictures or videos shared in goodwill or obtained via hacking or coercion to demand money, sexual favors, or coerce survivors into sharing more explicit content. So I hope you can see there are various forms of TFGBV, and on the next slide in the report we also have case studies and real-life examples of what those forms of TFGBV could be. So either a girl, like people sending private pictures to someone in a relationship, or having their social media account hacked and pictures stolen, playing a game online, or being a public doctor that was targeted with fake accounts, and which later basically ended up in her being killed. I'm not going to read all of this, but I'm sure you will get the report. So I hope you will enjoy, and I hope you will enjoy now Hiba coming in and telling now what is being done in Syria to counter TFGPV. Thank you so much, and sorry for being 2 minutes late.
Thank you, Sarah, and thank you, Eva. Hi, everyone. This is Hiba Azzeddin, the CEO of Equity and Empowerment. Sorry, I cannot turn on my camera because I'm in Idlib, and without electricity, the internet is not that much working. As Eva mentioned, that we participated in a report prepared by UNFPA and AGAPS in Northwest Syria. For myself, I started in 2018 to be a trusted partner with Meta. In order to develop the policies related to the Middle East, because communicating a photo of a woman without head cover or hijab may lead to killing her. That happened. Let me start by a story that happened in 2017 when a lady from the countryside of Aleppo called Rasha says one of her friends leaked her photo without head cover. And it was published online, and many people just communicated that. So the next day, her brother killed her, fired her, and videotaped her, and published that online on Facebook and other media channels in order to say that he washed his honor. Because as we know, as Eva mentioned, that still we have the honor killing in Syria, and still it's not criminalized in law. So, but like, of course, this journey didn't go without challenges, and we used to have a lot of challenges. The first one is the high stigma, and all the time blaming the victims instead of supporting them, because in any case, whenever we have a woman that is, her account is hacked or she is exploited, so the people who surround her start saying that if you don't communicate your photos or you don't use even your profile photo, no one will hack you or to apply any violence against you. So it's too much blaming the victim. The second one is most of the victims are afraid of retaliation from the family and the community. So, and we experience this a lot, many times whenever we have like victims in our centers. They're usually afraid to raise the issues or to have any legal procedures, because they're afraid that like their families will get revenge over them. And this is affecting the reporting rates and reporting channels. So we rarely find like women, especially women and girls, report the cases of hacking accounts or the persons who are trying to secure them or to exploit them financially, because like they're having their photos or they're having their private information. On the other hand, when it comes to the legal framework and the Syrian laws, till now we don't have. We have some articles, but they're too much related to the political side, and for example, like insulting the government and using the photos of the public figures, and mainly the governmental figures, but not something related to the cyber violence or TFGBV. Also, the digital literacy is one of the issues that it's really important because most of the women and girls, I mean, many people, all the people, but like especially for the women and girls and in the rural areas, they don't have access to the digital knowledge, and this is affecting too much their behavior online and putting them under pressure all the time of the TFGBV. And also because of changing the political aspects in Syria, every time we have new aspects of threats. So like after the fall down of the regime in the 8th of December 2024, new forms of TFV appeared against women and girls, and especially journalists and women who are public figures, and women who are having like followers online. Next slide,
Hiba,
please.
sorry, I just want to
Yes.
let you know that you only have about 30 seconds. Maybe you can go to the
Okay.
tools.
Sure. So what we try to develop and what we practice is that like in our centers we use to open digital safety clinics for women and girls. In those safety clinics we have safety plans, and usually we have one-to-one interviews with those women in order to support them with all the materials. Also, like the training on the cybersecurity, we do this at the universities for the girls and boys, for the women and men, and also doing like context sensitive awareness campaigns using the accessible and non-technical language, because like I mean we learned that like the technical language is really hard to understand by people who are not like too much experts in this. And also the approach that we're following is the survivor centered, not to blaming the victim, not asking too much details because we want to support her, and also the community-based prevention by the women-led groups and the trusted actors, by like teaching women and equipping women with the skills in order to prevent others and to report online. So those women were as focal points in their communities. Very quickly, just in 2 seconds, next slide, please. Also, one of the things that we do, we developed what is called DCM, that is digital security, digital case management. So in that way, we just train the organizations doing the GBV on how to combine the technology aspect and the cyber violence aspect to their case management, and also how to in our centers to combine both. So I'll stop here because I think that the time is flying, and I'm honored to be here, and of course, like I'm ready to have any question.
Thank you so much, Hiba. Sorry to pressure you guys, but I know that people are going to want to ask questions in the Q&A. And if we have extra time, we can go back and delve in deeper into some of your slides. Next, I'd like to welcome Sajai from Stop Online Harm, who's coming to us from Asia. I first saw her presentation at the Asia Development Bank, and so we're very happy to have her on board. Sajai, if you'd like to share your screen. There we go. Thank you.
Sorry, I realized you cannot see me.
We can hear you now.
Okay, great. Thank you so much, everyone. So my name is Sajai. I'm a founder of Stop Online Harm. I'm just going to share a story from Myanmar. So we are working, our story started in Myanmar. As you know, after the coup happened, women are the forefront of the protests. And that is come to a lot of experience with TFGBV. So when we think about TFGBV, we often thinking about technology and gender-based violence. But in Myanmar, there's a layer of conflict, or like in Syria, on the background. So how could we talk about TFGBV with a conflict as a background? So our team has done a study on this, and we call it DCRSV. I just want to share a bit about what we have learned in this study. So we have been collecting 615 cases. These cases are collected from open source data, which is shared online. And based on the 615 cases, we collect the data right after the coup, February 2021 until October 25. After collect all these cases, we have been consultation with 20 women groups, civil society, to confirm the trends that we've seen from the case. So the emerging trends that we have seen, I'm going to walk you in quick details. We see a lot of like state-linked pressures that against the women who left Myanmar. So the first trend that we've seen is that we learned that digital safety threats are not constrained by borders. So which means that we've seen that a lot of women who already left Myanmar after the coup, they have still been tracked by the military by using online space as a way to keep tracking the activities and what they do. The other second key takeaway we learned is that non-consensual intimate image or NCII abuse and doxing are the most prevalent form of TFGBV, and it's often happen with coordinated campaign targeting to shaming the woman. The platform that prevalent for the sharing of non-consensual intimate image is Telegram. The pattern that we seen would be each day there would be a woman that the military select and share the image of the woman by using AI to create a deepfake image of her and share that on Telegram channel to shame the woman who speak out during the coup. The third key takeaway that we learned is that technology is also used to enable sexual control. There are cases that we found is that after the women were raped by the military, the military sometimes give them mobile phone and use that phone to track them. And later on, the women were wondering why the bad actors knowing where they are, and they realized that the phone that they were given have GPS tracking location on it as a way to learn what they do and where did they go and their movement. The other key takeaway, which I found this is really insightful, is that even though for documentation, even if well-intended, can reproduce harm, this means that when the conflict happened, a lot of journalists and reporters try to report on the incident. But when we speak to survivors, they felt that it could also be a way of re-traumatizing them by sharing some of the content around without asking for their consent. The fifth key takeaway is that we found the rise of revenge doxing. What I mean by revenge doxing is that in the system in which there is no formal accountability mechanism, there's no justice. So when the women were harassed or were experiencing TFGBV, there's no way for the woman to go to the court or respond to this incident. So what we learned is a phenomenon in which a group of women also creating a Telegram channel. So Telegram were the tool that they used to be harassed, and they create their own Telegram channel, and they actually share the image of the person who the perpetrator in that image and say that this is the person who did this to me, this is the person who doxed me. But it's also like sometimes we do not know either whether that person actually committed this act. So it's a way of revenge doxing back because there's no justice and accountability system available. The sixth key takeaway that we've seen from the situation in Myanmar is on AI and synthetic media. So we recently seen that in the past year, we've seen the rise of AI in terms of the image that being harassed woman is being created and being used by AI tools. Anyway, so I just don't want to end this with a sad story about how the situation of Myanmar TFGBV, but we also, as an organization, creating 4 response that I would like to share here. The first response that we developed, as mentioned, our story started in Myanmar. We are a group of survivors and the women who experienced this online harm ourselves, and we cannot find any system to support. So we built together this online ambulance, which is what we wish they are there when we were harassed. So what does this mean by online ambulance? We developed it to support that if the woman have been harassed, they can reach out to online ambulance. At online ambulance, we provide 3 support. The first one, we help to remove harmful content by we are trusted partner with the platforms. Second, we provide emotional support because we understand from our own experience that it's not just about removing the image, that it's a digital trauma that stay with us. So we have a psychosocial support ready for the survivor who reach out. And the third, we wanted to be able to bring justice someday, even though in the time there is no justice. So we study about how could we document the case and how could we document evidence that is happening. So these are the 3 support that is available. We started in Myanmar, but right now we expand these services to Thailand, Cambodia, Laos, and also in Rohingya camp in Bangladesh. Just want to go to share a bit more in details about how the online ambulance work. So there could be survivors who've been harassed. They could reach out to us either via Messenger, Telegram, or whatever channels. And after they reach out to online ambulance, we would send them a form, a platform that they could go and fill out the information that they've been harassed and their case. And after that, within 24 hours, there would be a person who respond and support them with the 3 support that I mentioned earlier. And after that, there would be a follow-up within 1 or 2 weeks to see how they're experiencing. One thing that we learned from set up online ambulance, there are 3 couple things that I find interesting to share. First is that a lot of survivors who experiencing online harassment don't want to use the same platform, which means that, let's say, if survivor were harassed on Facebook and they might be on Facebook and they reach out to us via Messenger, they do not want to keep Messenger to keep talking to us because that was the platform that they've been harassed. That's why that with the online ambulance system, we send them a link that take them out of the platform that been harassed to the online ambulance platform that they can fill out the data in a safe and secure way so the data do not stay in the platform and they have a chance to go back and block and do not want to use Messenger again. That's one learning that we found. The second learning that I found interesting is that people really hate when they even think that it was AI or chatbot respond to them. So there was a time in which it was a holiday for us, so we cannot respond. We set up a AI response in the way that, thank you so much for your message. We will get back to you within 3 days because right now our team are on leave, it's a holiday. And we learned that during that time, the trust in the system will reduce, even though it's an automatic message saying that, we will come back to you and talk to you. We just on a break. It's really when we talk back to survival and learn from them, they said that they don't really trust it because when they say something, it's just like an automatic message response. Even though for us, they are human after we respond. So we learned that it's really important when survivors reach out to us, we try not to use any automatic response unless we need to. We often respond by human, but even the time that we are on leave, we're just gonna wait and find someone to come back and respond. Then having survivor feel like it could be an automatic response. And the third thing that we learned during online ambulance is interesting in the way that we also sent out a survey asking for people experience of online harassment in Myanmar. And the survey actually showed that there was a lot of people who say, yes, I have been experiencing online harassment, but they have low connectivity to the internet. So I will just let that sink in. So basically, a lot of people who say, yes, I experienced online harm, actually also come from the area where there's low connectivities to internet. So that is something that we wanted to explore more because intuitively you would think that if you don't have much access to internet, you will have less harm. But actually, the learning that we found is the opposite. So apart from that, I just wanted to highlight that a lot of cases that we respond is not just normal TFGBV. We also have cases that coordinated TFGBV. What I mean by coordinated TFGBV, I just want to use an example in Thailand right now. We respond to the cases of the journalist who reporting on some really important issue in Thailand Deep South, and she has been trolled by the information operation. She got thousands of messages harassing her. This is not just one person, that normal case of TFGBV that we experience, but it's actually the whole army and it's coordinated. So right now, we are learning to adapt our model of online ambulance that respond to normal case to be able to respond to coordinated TFGBV. How do we respond to that? So there are 3 things that we're doing right now. For example, this is her case. I'm actually, first we actually try to do a whole research of what are her experience and the data of the harassment. For example, from this research that I share here, we work with partners to conduct the investigation. We found that there are about 2,000 messages that harassing her, and we try to find the network of the harassment. So that's one, we want to use data to advocate. Second, we actually bringing this to Parliament. Like today, I just came back from Parliament. We actually draft the case and try to submit to the Parliament to call for Parliament hearing to make sure that this is not just the case that disappear because she's the media and media is an important pillar of democracy. And the third area is we try to figure out how could we reach out to influencer to promote more peace messaging in her case, because a lot of information about her was disinformation and people actually come to her house and wanted to, like harass her physically. So I just want to bring up this case because it's really critical to think about TFGBV, not just in a normal context, but what happened when it's coordinated TFGBV. So this is something we're still learning and documenting and experimenting about what are ways to respond to coordinated TFGBV. And we're happy to share more case study later after the case is a bit resolved. Anyway, I just want to share a quick impact from the past year. We have been supporting more than 1,000 survivors that reached out to us from Thailand, Cambodia, Myanmar, Laos. And we managed to reach about 7 million people that are online. So this is like 7 million individual people that access to our resource. We've been documented about 900 cases of TFGBV. I mentioned about 615 earlier, and we've been documented more. And we have been surveying more than 3,000 people because we want to learn about what are the best way that people experience about TFGBV. But these are the pillars that I mentioned, about 4 pillars. First is providing response. The second pillar, as I mentioned, is about outreach. So how do we do that? How do we manage to reach out to 7 million people? We actually partner with Meta. So we have a partnership with Meta last year in the way that when a lot of women in Myanmar open Facebook, our content about safety content will show up. This is example content that will show up to about 7 million women in Myanmar. So we ensure that women have access to safety resources. The other part, the third pillar that we mentioned, apart from provide direct support to survivor, doing outreach, is research and innovation, because we want to know what's going on in the country. So we have done, these are the 4 research we're hoping to publish soon. It's already published. We're just thinking about in terms of the sensitivity of the research to remove some content. But one research that's shared here is about non-consensual intimate image that I mentioned. We look into the use of Telegram and how Telegram is used to share intimate image of the woman. We look into the legal element of TFGBV in all the 3 countries. But one interesting research that I would like to share that we will be releasing perhaps at the end of this year is that we're doing an RCT, randomized control trial, with MIT and also UCL. This is a funding from JPAL. Is actually, we wanted to know what are the way to support survival of TFGBV. So we are doing an RCT, impact evaluation, on the online ambulance itself. So we work with a university student that have access to online ambulance, and then one group that we will provide them online ambulance later. But all of the group will have access to basic services, and we wanted to test out using RCT to see which services actually improve their well-being and help them recover when they experience TFGBV. So I'm very excited about this research. I'm happy to share more. Apart from that, I just want to end it by even though outreach that we do, and we also work on supporting survivors themselves, and then the research, these 3 things are not enough when it's come to TFGBV response. We really wanted to change the system. So right now we're working with legal and also platform accountability. On the legal side, right now, we actually working with the Thai court to, we have helped decide the bill of take it down, and the bill already been using in Thailand. At the same time, we have been working with the Thai police, because we learned that when TFGBV happened, people go to the police station. So the Thai police actually reached out to us and asked, like, how do they respond when survivors of TFGBV come to the station? So right now we're working to design SOP that we'll be using with Thai police in across the country. And yeah, and after we're talking to the police, judges of Thailand also come to talk to us and say that, okay, now if the police are equipped with TFGBV, but how about the judges and people in the justice system, because the case have to come to the judge as well. So yeah, so we're also hoping to working with the judges to develop a SOP on how to respond and support survivor and ensure the survivor voice were heard in this process. Yeah, thank you so much.
Sajai, that was wonderful. Thank you so much. So many things that you all are doing there. And I know, like others, I was frantically taking notes. So just to remind you all, it will be shared and it is recorded. So you'll have a chance to come back. And Sajai is also a member of the community of practice. You can always reach out to her and talk to her about her amazing NGO and the work that they do. Okay, so now I'd like to invite Erin from UNFPA. Erin and Stephanie are going to show some of the case management tools that they've been developing. Again, I just wanted to let you all know these are not available online. You have to request them. I'm putting the link in the chat here, and you can get them. And we sent you a link to request them before, but we'll be looking at them today. But you can't just go to a website and download them. And Erin will explain why. Erin and Stephanie, over to you.
Hi, thank you. Hi, everyone. My name is Erin Gerber. I'm a GBV response specialist with UNFPA and our headquarters in Nairobi. And my colleague Stephanie Mickelson is joining me, and she is our GBV, our TFGBV program specialist. So most of what I'll be presenting towards the end of our time will largely be the work that Stephanie has led. So she's here to help answer questions and support in the chat as well.
Thanks. And Shiva, could you bring the presentation up? Sorry.
All right, thanks. Sorry.
Yeah. Sorry about that, Erin.
No problem.
There we go.
So,
In the presentation.
okay, great. So we're on the first slide.
Yeah.
Yeah. Great. So yeah, UNFPA has been advancing efforts to strengthen GBV response systems through global programs like the Women at the Center program and making all spaces safe. So we can go to the next slide and I'll just talk to you a little bit about the Women at the Center program briefly, but the majority of this presentation will really be on making all spaces safe, which is the work that Stephanie's been leading. The goal of the Women at the Center program, though, is to increase and sustain the availability and accessibility of quality case management services for GBV survivors, particularly those from historically oppressed and discriminated communities. So this program has been implemented in 5 countries, and the reason why I wanted to mention this is because we conducted a baseline assessment at the very beginning of the program. It was the majority of the first year. And those findings captured at the start aligned with GBV program manager and caseworker demands for tools and resources to effectively respond to TFGBV. We can go to the next slide. So countries have implemented those baseline assessment findings over these last 3 years by incorporating TFGBV in their national GBV case management curriculum that supports the professional training of social workers through accreditation pathways. And we'll be exploring opportunities to more comprehensively incorporate TFGBV into case management environments and systems through the TFGBV training package that I'm going to share with you in a moment. I just kind of want to take a little bit of a step back from the Women at the Center program to talk a little bit about the work that we've been doing under the umbrella of the GBV IMS Steering Committee. And through our focus on government rollouts, in the beginning, together with UNHCR, we started to explore opportunities to reflect TFGBV in the GBV IMS tools, like the assessment intake form and classification tool. So discussions with different country teams and the GBV IMS Case Management Task Force have focused on exploring data points that capture the online-offline continuum of TFGBV. So for example, looking at the assessment and intake form, we've talked about including an option for online under location of incidents for those who where incidences have not taken place in person at all, that it's just been an online experience. And also adding the option for unknown for the location of the perpetrator. So that's if it's, a perpetrator we don't know that's just getting all of this inappropriate information out or who's tracking, but we don't know who that is. We've also talked about adding a question, does any aspect of the survivor's experience of GBV include the perpetrator's use of technology, social media, or a digital tool? And this would help us analyze the presence of TFGBV. So we're not proposing a separate typology for TFGBV, but an additional context to analyze. So for those of you who are familiar with the GBV IMS and that classification tool, the first page of the tool explains those different typologies, but the end of the tool is looking at different contexts like child sexual abuse, intimate partner violence. So this would be one of those. So this is just something we've been exploring, again, together with the GBV IMS Case Management Task Force. that we think could hopefully be a good starting place to support survivors experiencing TFGBV throughout the case management process. So those are kind of two ways that UNFPA has been looking at integrating TFGBV into work we're already doing. But we can go to slide 4. And I'll talk to you a little bit about the Making All Spaces Safe program. We also call it MASS, so I'm not used to saying the whole name. But UNFPA is doing this in partnership with Global Affairs Canada. It's a global program completely dedicated to addressing TFGBV, and one of the primary objectives is to institutionalize a survivor-centered multi-sectoral response to TFGBV by equipping frontline responders with the technical competencies needed to identify and respond to incidences of TFGBV and mitigate the risk. We can go to the next slide. Yeah, so this is a flagship program for us designed to confront the rapid rise of TFGBV and protect the rights of women and girls to be online safely. We operate across these 5 strategic pillars. This program strengthens the global, national, and community level capacity to prevent, mitigate, and respond to TFGBV by integrating targeted activities into existing GBV programming. So the initiative also works to strengthen prevention and mitigation efforts through the promotion of rights-based laws and policies, which has already been mentioned, and safety by design standards and tech development. In terms of case management for TFGBV, this sits predominantly under that response pillar, and there are 2 major pieces of work here. One is a TFGBV Global Response Hub. So I think this links to the online ambulance and the other examples we've heard. This is for frontline providers supporting survivors to receive cybersecurity advice from tech experts in relation to complex TFGBV cases. So this is really a platform for case managers and others who are supporting survivors of TFGBV to be able to get that tech advice for those complicated TFGBV cases. And this will be complemented by a public-facing knowledge library. It's all being piloted and tested right now, so we're hoping it'll be available at the end of this year. The second major component is the TFGBV training package. So we could go to the next slide. And I just wanted to make sure that you have the context of the program in which this was developed. It's a 13-module global training package. It consists of 7 foundational modules and 6 sector or role-specific modules. So those 6 sector or role-specific modules include the social sector, health, justice, law enforcement, educators, and disability support workers and caregivers. So this is designed to equip service providers with the capacity to identify, respond, and to refer incidents of TFGBV. And really the idea is that this has all been designed to work across humanitarian and development settings. So we piloted this training through a training in 2024 and conducted a regional training of trainers in the Arab states, Asia Pacific, and West and Central Africa. And to ensure the sustainability and national ownership, 7 countries underwent comprehensive localization processes. So up to now, we've reached more than 1,000 frontline service providers, GBV actors, and digital rights organizations, with translations in French and Arabic currently underway, and a rollout slated in the coming months in an additional 10 countries, I believe. So some of the key outcomes we've seen at the country level include the establishment of formal TFGBV working groups within existing GBV coordination mechanisms and systems, updated GBV service mapping and referral pathways that specifically integrate TFGBV specific services, and bridging the technical gap between traditional GBV responders and digital right advocates. So this is all super interesting as well, and I could go way more into detail about that, but I know that you want to hear about the training package tools, so we can go to the next slide. And I'll just mention, we'll come back to this slide, but I'll just mention that under the global training package, several key tools were developed in close consultation and collaboration with expert consultants, sister UN agencies, online safety regulatory bodies, and regional and country office focal points in both humanitarian and development settings, again, to ensure that the tools are applicable across contexts. So we can actually stop sharing this slide, and then Stephanie will share the first tool, the tech safety checklist, just so you can see what it looks like. So the idea is not to go in depth, like in detail on each and every one of these, but just to give you a bit of a teaser so you feel familiar and very excited to go to these tools yourself and check them out. So this tech safety checklist is designed to be used by any frontline responder in collaboration with the survivor, of course. It's a risk mitigation framework designed to help service providers seamlessly integrate tech audits and hygiene into traditional safety planning or risk assessments. So rather than advising survivors to simply disconnect from all technology, this checklist provides practitioners with a structured methodology to audit account vulnerabilities, secure device settings, and establish safe communication protocols. When we first started building this tool, this module and the training package, our initial plan was to point participants towards existing tech safety checklists and digital audits. There are so many fantastic publicly available resources out there produced by trusted partners. But as we started reviewing them, we realized almost all of them were designed for the global north. So they just did not speak to the realities of resource-constrained settings, let alone fragile or humanitarian contexts. So rather than reinventing the wheel, we used those existing tools as a baseline and took them directly to our country focal points working across those humanitarian and development settings. So Stephanie's been scrolling through the tool, and it covers an initial safety and communication check to ensure that the very first interaction and engagement moving forward with a survivor is secure and safe. It covers shared or borrowed devices. I mean, many of us are working and operating in these environments where women and girls don't own their own phones and they share devices with family members. So that introduces an entirely different layer of surveillance and privacy risks. There's also a dedicated lens for humanitarian and fragile contexts. This speaks directly to emergency settings. So this was touched on already, where vulnerabilities are hyper escalated. And so it's addressing everything from compromised common charging stations to situations where survivors might feel pressured to compromise their data privacy just to access life-saving aid. This tool also navigates restrictive environments that actively police self-expression. So specifically targeting risks faced by LGBTIQ plus people, for example. And then after all those sections, towards the end, there are the more standard audits around account security, social media usage, tracking, stalking and surveillance, and home and smart device security. So there's quite a lot in there. Stephanie's scrolling through for you. And there's also an annex with QR codes for basic cyber safety and cybersecurity tips and strategies that every service provider and survivor should know to be able to keep their own devices safe. So we're just going to rush to the next tool, which is a job aid to support a comprehensive response to disclosures of TFGBV. I'm aware of the time, Sarah, and I'm trying to hustle.
So it's okay, Erin. Deep breath. It's all right. I'll give you a little more extra time.
So many of you on the webinar today, I think, are very familiar with GBV case management systems. But as violence has increasingly migrated online more and more, we've noticed this massive operational gap when a survivor discloses that a perpetrator is tracking her location with a smart device or controlling her online banking or threatening to leak intimate deepfakes, for example. Standard case management tools often don't account for all of these scenarios in a detailed or guided way. So to address this, we've developed this dedicated job aid, and this one's under module 6.1 of the training package, which is geared towards the social service sector. And it's designed to sit right alongside your existing case management tools. So this is all not necessarily to replace what you have in place, but to give you sort of a menu of options based on what your operational capacity is, based on what you feel like caseworkers already know about TFGBV and would be comfortable taking on. So the steps for the job aid correlates fairly closely with the 6 standardized GBV case management steps that you may be familiar with from the Interagency GBV case management guidelines. And there are some deviations here because of this unique nature of TFGBV, mostly around the preservation of digital information for the purposes of evidence in the event that the survivor wants to pursue that legal action. So, as we scroll through this, we first look at safety before asking any questions. The tool walks us through a checklist to ensure that the survivor's channel isn't actively being monitored and it's offering immediate kind of workarounds like safe code words or setting up unlinked communication lines. It then includes this comprehensive matrix of what TFGBV could look like, designed to get the survivor and the service provider thinking through all the possible actions or behavior that could constitute TFGBV. So things that we might not have thought about before, like micromanagement of shared calendars or the administrative control of her accounts. And then it looks at perpetrator reach. This is because the risk level changes completely depending on who the perpetrator is and their relationship to the survivor and what skills and resources they have at the tips of their fingers. And the tool gives advice based on whether the perpetrator is, for example, an intimate partner with physical access to the device or a caregiver controlling assistive technology or an actor with state level surveillance capabilities. And then based on that above assessment, the tool provides 12 distinct flexible response options for the survivor to consider. It helps the survivor choose from tiered strategies ranging from blocking specific notifications and requesting platform takedowns to executing a safe factory reset without alerting the perpetrator. And then finally, it addresses the issue of digital information for evidentiary purposes. Survivors often want to delete abusive messages immediately or have harmful content removed forever, but doing so can destroy potential legal evidence. So this tool guides us on how to safely capture screenshots, export chats, or request data preservation from tech companies while tailoring the storage method based on the perpetrator's physical access and technical expertise. And then finally, and I will just take 2 more minutes. The third tool is a safety planning template that integrates offline and online considerations when developing a safety plan with the survivor. So it treats physical and digital risks as fluid and kind of this interconnected continuum. For example, it maps out safe physical locations alongside unmonitored accounts or alternative communication devices that are safe to use. So the template just walks us through protective risk mitigation before violence happens, like setting up code words to counter digital impersonation or backing up digital data, in the moment crisis strategies and exit planning. And then it also touches on preservation of digital information like screenshots and timestamps for future legal action. So this is linked to the tech safety checklist we went through before, for a more comprehensive audit of device. So that's all I'm going to say for now. I feel like I've already gone over time, but for all these tools, we encourage that they be adapted to the country context where you're working and used alongside existing GBV case management processes and resources. So if we want, we can go back to that slide with the QR code on it, but hopefully you all got it before. And because of the sensitive nature of these resources, they're not available to the public to download. And this is really just to protect survivors by ensuring that strategies used to circumvent tech safety and guardrails don't become a roadmap for perpetrators. So please do request, and we will be happy to share them with you. Thank you very much.
Thank you, Erin and Stephanie. That was really great. I know that everyone's really appreciating a chance to get a glimpse at this, and I hope you all use the QR code. We also put it in the chat. Now, I wanted to invite Ezra from Seed. You had some tools from Iraq that you wanted to be able to speak about too. So please unmute yourself and
Yes. Hi,
tell us a
everyone.
little bit more about your work.
You can hear me well?
Yes.
Okay. I'm so happy to be here with all of you, and I would like to thank you for the great presentations of today. And I would like to first introduce myself. This is Isra Sabit from SEED. SEED is a women-led local organization based on Kurdistan region of Iraq, and actually have been working on responding and supporting TFGBV survivors and GBV survivors in general for almost 10 years now. And also, I can say, we were the first ones who advocated for incorporating online violence in the GBV IMS almost 5 years ago. And in this regard, I would like to introduce one of our tools and guidelines, which is a practitioner guide for frontliners and case managers to safely and effectively responding to the online violence cases. And briefly, I would like to give you an overview about how this guidelines or guidance was developed. So SEED chaired and led the National Online Violence Task Force in Iraq with the co-shared organization IOM. And actually, this task force is a national-wide coordination mechanism established to strengthen prevention and response effort related to TFGBV and TF-OXIA across Iraq and Kurdistan. SEED as a leading organization with IOM, also they brought together a broader network of national and international actors working in GBV, child protection, digital safety, legal protection, physical support, and online response in Iraq and Kurdistan. And actually, this guidance document was developed in consultation with the member of the task force based on their practical experience on the field. In addition to this, also this document was financially supported from the Safe Online program. So mainly, as I have mentioned, this document is meant to be disseminated with the case managers, the frontliners, GBV actors, and child protection actors to make sure that they are safely and effectively responding to online violence cases in Iraq and Kurdistan region of Iraq. Actually, this guidance, it's not a separate document from the existing GBV or child protection SOPs that we have, but it's a complementary document that is providing a practical survivor-centered approach for how to handle TFGBV cases and TF-OXIA cases. Also, it includes digital safety planning and evidence management, mental health and psychosocial support, physical safety, protection planning, and safe referrals and engagement with law enforcement actors and digital platforms. The main objective for this guidance actually is to fill the existing gap, and I believe we can relate to the context in Syria because Syria and Iraq have similarities in terms of the risks that survivors might face. So it's mainly to fill the existing gaps in practical guidance because we all know there is a lot of tools in terms on how to respond effectively to online violence cases, also to equip practitioners with actual tools and approaches for the case management to strengthen the survivor-centered, right-based, and child-sensitive response, in addition to improving digital risk management and safe removal of the harmful content online. Also promoting the coordination between different actors to make sure that we are providing the best services to the survivors. One of the things that I can say here also, this guideline is highlighting the main risks that we can face in Iraq and Kurdistan, which include the stigma, the honor-based violence, social exclusion, and retaliation in other cases, of course, because of the exposure to the online violence. This is briefly about the guidelines as a guiding document. And also in this regard, I would like to mention about another tool that we have at Seed, we have developed. It's a safe online toolkit. This toolkit actually it meant to support practitioners and organization on responding on online violence and technology facilitated abuse. It's building on the experiences and the lesson learned from Iraq and Kurdistan, and also Seed now is seeking funding and partnerships to further expand this work beyond Iraq and Kurdistan. And one of the good things about this toolkit, the knowledge is easily to be transferred, and the tools, it's so practical where you can easily adapt it to different contexts, and also it will be useful for another similar humanitarian and development context. I hope
Thank you,
I
Ezra. Thank you
didn't
so
take a lot
much.
of time.
I'd like to now just open it up. We have one of the questions here. Thank you, Ezra. And your tools will be in the resource list that we'll share.
Yes, sure.
Um,
Of
I
course.
wanted to open up the question, and I think Megan, you said you'd be interested in answering about the question about awareness raising. How do we incorporate the awareness raising?
Yeah, so I mean, I think there were also some responses in the chat already, and I did put something in there, but I did want to share our experience using our virtual safe space platform, laha.org, and maybe my colleague Caro, if you can put the link in there for me while I answer, that would be great. But you know, we have a whole library of materials on digital literacy and online safety. And of course, they're not, you know, just it's not the platform isn't just for that. It's also, you know, in a wider library of materials that have information on GBV and sexual and reproductive health and mental health as well. Well, one of the things that we found, obviously, because we know in humanitarian settings, not all women and girls are going to have access to a phone. One of the things that we've found is through our implementing partners, we're actually starting to use some of that content that we've developed online. It's in multiple formats, video, podcast, and interactive modules in in-person settings, so in women and girls safe spaces. So, you know, case managers or adolescent girl group facilitators, women group facilitators are using the content and using the platform to teach women and girls about digital literacy and digital safety. And then the other thing that, you know, really happened organically is some of our partners, their caseworkers are using Laha as a tool, really for psychoeducation. So beyond TFGBV, but you know, are using the content to be able to provide information to women and girls in case management sessions. So yeah, check it out, and you know, I think it's you know, really thinking about multiple avenues to reach women and girls with the information that they need.
Megan, I invite any of the other panelists who'd like to speak, or if there's someone from the audience who wants to add in. We still have a few minutes, but I wanted to just flag this really great conversation we were having in the chat as well, which was about when, you know, the use of chatbots and QR codes. People are always looking for that, but what you found, Saijai, the importance of having a human being behind there that responds to people. I thought that was quite interesting and a strong lesson that we can learn. And I think Caroline also added a paper that she and Sarah Spencer had co-authored in the chat that I'm looking forward to reading as well. Would any of the other panelists like to respond? You could just unmute yourself.
I think it's, please go ahead.
Oh, sorry, go ahead.
Sajay, and then
there you go.
Ava.
Yeah.
Sajay,
I
then
think just
Ava.
to the outreach, I think what we learned is that sometimes collaborate with social media platform could also help expand the outreach. Just that mentioned that we managed to reach to 7 million women and girls is because of we asked Facebook to help us promote the content online when women and girls go onto Facebook and see the content. Yeah.
I think there are multiple things that can be said about raising awareness and how we talk about TFGBV. In our experience, when we collected data, we had to be very careful to use appropriate language. So it would be too difficult to try to facilitate a focus group discussion with women and girls and ask them about digital harms or technology facilitated gender-based violence. But when we started about how do you use your phone, for what do you use your phone, who are you connected to, and what kind of messages do you receive, that more less technical language was really key to getting the information that we needed. So when it comes to raising awareness with communities, we have to be very mindful of the language that we use. And the other thing I wanted to say is that equally important is raising awareness within the humanitarian community. Because there were many questions about whether GBV case managers and specialists are sufficiently informed about the risks, and they are usually not. So the first awareness that we need to raise is within our own community, the humanitarian community, on how we process data, how we collect data, how we store it, and what kind of risks we expose people to through our methodologies and how we handle data. And I think that these were the 2 points that I wanted to raise.
Great, thank you for that. Sajai, did you want to say anything more about the background of the importance of the human touch that you spoke about in your thing? I think that resonated with a lot of people about the lessons you've learned there.
Yeah, I think I already shared a bit about the chatbot. I think the other thing that's quite helpful is that a lot of time when survivors reach out to us, sometimes there are things that it cannot be removed, even though we report to social media. So there's a lot of cases like that. But when they said that, okay, they are report, but it cannot remove and they know it, but actually sometimes what they need is someone to talk to and listen. So I think a lot of time when our helpline try to support them, we tend to like, okay, how could we solve this problem? We're thinking about, okay, we want to remove this content, take it down the content for you. But what we also learn from them is that they say like, actually, they know and we know, like a lot of time we try, but it cannot be moved. But they say like, actually, I want to call you not just for you to solve the problem for me or help me take it down, but I just want someone to talk to and listen. Yeah.
Yeah, that's so important too, because I mean, I feel like just some of the work I've been doing as a consultant, there's this rush to everything for chatbots and things. And, and I always remind people for survivors, they often just want to be validated and heard what happened to them. And they want to talk about what's going on with them. And, we have to have that human touch as well. And that's, the key to our survivor-centered approach too. It's not just a word or an acronym. At some places are even making it an acronym. But we mean this, that the survivor should be in the middle and we should be bringing to them the support that they need. So we still have a few more minutes before I'm going to launch our evaluation. Is there any other questions or would anyone like to share a bit more?
I was just writing something in the chat, but if there's a minute, I could just say it, Sarah.
Please.
Just because of this whole conversation you were just having now, it kind of reminded me of something we've talked about in other discussions. What comes up in the program that I manage a lot is that I think caseworkers just feel like as soon as a certain level of technology comes up in the case, that they're like not equipped. They can't do it. They just sort of like turn off, like they don't know how to handle it. And I just want to remind any caseworkers that are in this call, like you can do it. Like you're already doing it. Technology facilitated GBV is actually not new. I always talk about my first TFGBV case was in 2009 with a Nokia phone where a driver took a photo of someone in a communal bathing facility in a refugee camp in Thailand and let other drivers pay him to see that photo. So that's always been a complicated case, but we've been able to work through it. And yes, there are absolutely evolving forms of technology that feel like really out of control and overwhelming. But I just want to encourage you, like, not to step away from the survivor because the skills that you already have are so important. And I think like, yeah, we sometimes just get this reaction of like, turn off all your devices. But there's also ways that survivors use technology that's healing for them and really good and promotes social connectedness. And all of that is super important. So just to encourage everyone who's already doing the work, like we've got this, there's all these great tools and all these wonderful organizations represented here that are doing wonderful things that they're bringing to us. So yeah, that's just my last piece.
That's a great way to end it too, Erin, because yes, that's kind of our ethos here in the community of practice as well. We're here to support each other. We're learning from each other. The things that we're seeing in Syria are similar to what's in Myanmar, similar to other places as well. And we can share tools, we can share learning, we can share experiences, and we can share support. Um, Sometimes people feel that they have to know everything. They have to know everything from the beginning and they can't ask a question. But the only way you can ever learn is to ask a question for someone to share with you. And often what we learn is everyone's wondering the same thing, and we haven't had a chance to sit down and really think about it. And I know that from a lot of the people here in this room, I have learned so much myself. So I'm going to ask us now to hit this evaluation. If you can let us know what you think of this webinar. As I mentioned earlier at the beginning of the thing, this is the first webinar we've done on the community of practice since we lost our funding in 2025 and we came back briefly. So a little bit of data will help us out a lot. Again, this came from a question that somebody on the community of practice asked. They wanted support on this. And that's what we're here to do, is to try to pull people together to answer the questions you have and to bring the resources to you that you may not know about. So, this is join the community of practice, ask your questions out loud, reach out to us. If it's too sensitive for you to feel like you want to write it under your own name, we do have an anonymous feature, but we hope that we're a friendly enough group that you can ask openly and see. But yes, we use our little bit of technology, although we're kind of behind the times here, but we do our best. So, and again, as I wanted to thank Shiva, my now co-moderator on the Community of Practice, who's been helping with this webinar behind the scenes and is a great source of support. I really want to thank all of our speakers today. Thank you, Megan and Erin and Stephanie and Ava and Hiba, who I think had to drop off, and Saijai and Ezra. So much learning, so much wisdom in this Zoom webinar. And I wish that we were all sitting around in the room so we could all go to the coffee break together and eat some chocolate and discuss the things that we've found. But we'll keep it going on online. Thanks again for everyone. We're going to share all the resources with you, including the presentations, and we'll put them up in the resource vault. If you have a resource that you want to share, or there's a question that you didn't get a chance to ask, you can send it to us on the Community of Practice or at the GBV COP. And let's keep this ball rolling. Let's keep learning, let's keep supporting each other, and let's keep hearing what everyone is doing, because I find it really empowering. So thank you very much, everyone. And we hope to see you again soon.
Thank you. Thanks, everyone.
Thank you.
Thank you all.
Bye.
Thank
Thank you,
you. It
everyone.
was a
Thank you.
pleasure.